We're now looking into part 3 of our talk about stem cells. We have here John R. Roland, MD. How are you? Thank you so much for joining us again.
Well, thank you for having me back a third time.
Yes.
I really appreciate it.
Dr. Roland, you are on the board of directors of the American Association of Stem Cell Physicians.
Yes.
And we've been talking a little bit about this the last 2 segments. We kind of teased a little bit about this, but can you tell us about your organization and all that it's doing when it comes to stem cells, stem cell research?
Well, I'm very proud to sit here with you and talk about that. The fact is that we've been working really hard behind the scenes in developing relationships, not only relationships with physicians that are doing and practicing stem cell medicine, but relationship with the universities and really raising the bar. There are lots of applications, but there's lots of questions about how to safely go about this, how to capture the data, and just what to do. So Dr. Farjam, one of the colleagues that was very instrumental in this group, reached out, for example, to Dr. Ronald Klatz, who is started A4M, which is one of the largest functional medicine training organizations in the world. And he helped us, and he is helping us in developing those relationships. So we want to share our knowledge and learn from each other about the best ways of using stem cells. That's easy enough, and I've shared with you a number of ways of how we're doing that.
Right.
The next step is to practice safely and establish some guidelines and establish some protocols. So we're reaching out to the FDA, for example, and we're going to be working with them in developing safety standards. There's been some concerns about adipose tissue. The FDA has made a determination that the process by which we get stem cells from adipose tissue makes it a drug, and therefore they want regulation about that.
Okay.
So it would be the most unusual drug that there's ever been. Can you imagine drawing fat from you and making it into getting stem cells and then thereby making it a drug? So
No.
how exactly do we do that? If that is the way that we do it, then how do we go about it? Right. So we're going to reach out to them and we're going to learn more about that. But further than that, we want to harness all of this experience that we have treating stem cells both in the university setting, internationally, and a lot of doctors practicing internationally have much broader experience using this, and even the experience that we have in the United States. How can we harness that and use it in an effective way to push the barrier so that we can teach others?
Right.
How can we do it safely, and how can we teach others to do that? So furthermore, as we've mentioned in prior segments, there are lots of different types of stem cells.
Right.
There's stem cells from blood, there's stem cells from bone marrow, there's stem cells from umbilical tissue, and we're going to have other tissues too. And the interesting part is it may be that we have specific products that are for specific conditions. And so we want to help that develop, and we want to help it develop safely. And so I'm very proud. I've been named chairman of the committee for guidelines and protocols. And so that's going to be very central to these issues as we go forward.
Yeah, congratulations. That's
Thank you.
incredible,
Thank
really.
you.
So tell me a little bit about maybe an example of one of the ways that stem cells are really changing everything and the way that it's being implemented. I know that you kind of touched on a story in our last segment a little bit about treating a kidney disease.
Yes. So one of the studies that was presented was a study, international now, a study from Egypt, using not stem cells, but just enzymes and communicating molecules that are excreted from the stem cells. It's not even the whole stem cell. And they also have microRNA. They're loaded with these communicating enzymes and proteins. And they merely concentrated that and they injected it into the kidney artery, the renal artery. And they got improvement in the kidney function for a year. And they increased performance of that failing kidney. These are kidneys that were grade 3 or worse, had an average GFR of 31. Truly severe disease, and they increased to 41, and that was sustained for the whole year. So several lessons that we all learn from that. Not only, it doesn't have to be the whole stem cell. It could just be these things that were excreted from the stem cell called the exosomes that carry maybe the same messages. And the other thing is that kidney disease is not one disease. It's multiple diseases. And these stem cells were able to affect most of those diseases. So there's much more to learn about how is it interacting with all of those disease processes. I lectured on some of those mechanisms. And then the third is these brilliant doctors were able to measure specific cytokines, TNF alpha, which is associated with inflammation, and transformation growth factor beta 1, which is associated with reduced inflammation, and IL-10, which is associated with reduced inflammation. So the point here, not to make it too scientific, but by being able to measure these, we were able to see the response of the stem cell products, and we were able to see sustained response for the duration of the study, and then we could see that the effect of the stem cells were starting to wane. TNF alpha was high, and it was suppressed during the course, and then it started to go back high again. So now we can start to measure if maybe we're not dosing enough, we're not getting enough suppression of the TNF alpha, for example, or maybe we are, but now the TNF alpha is starting to come back, and so now we need to repeat the dose. So we're getting information not only on dosing, are we giving enough, and when do we need to repeat the dose? It's very important data that we can gain from that.
Absolutely. That's really incredible. And I know we've said this before, so many moving parts coming together to make this really life-saving. And, what are some of your final thoughts on using stem cells in medicine and, how it relates to your practice as well?
Well, I look forward to treating patients, and I look forward to thinking creatively about this and solving yet unsolved problems. We're now starting to address conditions like MS and dementia and so many inflammatory diseases that we thought were untreatable. We can now start to frame it in ways that we can change the course of what we thought was untreatable disease. So there's a lot of educating that we need to do, both for our patients and for physicians and for the whole medical society as a whole. We have to change the way that we practice. I think that functional medicine and stem cell medicine have a central role in that process.
Absolutely.
And at least we've begun.
Yeah, begun and have been progressing and creating a lot of cutting edge research.
Yes.
Really amazing. And
Yes.
I know that you've had a lot of support and going through being a speaker at this national conference you were recently at. Can you quickly tell people kind of a little bit about that conference and how they can find out more information if they weren't able to watch it or they weren't able to get everything they wanted to learn from you?
Great, great that you asked that.
Yeah.
There is an association of stem cell physicians. We are actually going to change the name.
Okay.
We're right now the American Association of Stem Cell Physicians.
Right.
We're going to change it because we want to set that standard high and to teach doctors how to practice safely, and so we're going to change it to the American Academy of Stem Cell Physicians. And you can certainly see that on the website, American Academy of Stem Cell Physicians.com,
Okay.
American Association of Stem Cell Physicians.com. You can also see my website, which is evolutionmedicinedallas.com, and inquire about this. We have some ways of forwarding you to the national website as well,
Wonderful.
and ways of connecting you with other physicians that practice similar to mine.
Really fascinating. I know we've just a little bit scratched the surface of stem cells in this 3-part, and if you missed any of it, of course, the other videos are also online, but sounds like really, really great information, learning a lot. Is there anything else, Dr. Roland, you want to leave people with?
Well, I just want to express my gratitude to you for having me here and giving me the opportunity to tell you about what I'm so passionate about. So thank you very much.
It's incredibly interesting. So Dr. Roland, thank you.
Yes, thank you very much.